let's discuss the Chinese and Western medical thought, the disease causation in Western medicine, part 2. Among modern philosophical approaches to causation, Machi's Inus concept has been among the most helpful and was arguably the philosophical inspiration for the multi-causality model advocated by the epidemiologists like Rothman. Machi extended Homi's idea that causes and effects are constantly conjoined and used the logic of necessary and sufficient conditions to describe cause and effect relations. An Inus condition is an insufficient but not redundant part of an unnecessary but sufficient condition. In Machi's example of a fire following a short circuit in the house wiring, the short circuit alone would not have brought about a fire, but it was an essential, non-redundant part of a set of conditions: presence of inflamed material, absence of sprinkler, etc., that were sufficient to cause the fire. The Inus model would be helpful for explaining cancers that can be attributed to specific pathogens as the trigger factor. For example, the Helicobacter pylorus bacterium that is associated with stomach ulcers that could develop into cancers. This bacterium is not sufficient to cause stomach cancer, nor is it necessary, as many victims show no signs of the bacterium. But the clinical trials have shown that people who have it in their stomach have significantly higher chances of contracting cancer. For those who had the bacterium and contracted stomach cancer, the presence of the bacterium would be an Inus condition which, acting together with other unnecessary but sufficient factors, such as stress, irregular meals, and ingestion of foods with high level of carcinogens, could be a contributing cause to the patient's succumbing to cancer. In general, the presence of the bacterium would thus be viewed as raising the probability of contracting stomach cancer. This has indeed been borne out by observational clinical trials, and doctors now routinely administer antibiotics to remove it when it shows up in clinical examinations. Machi's Inus concept had helped epidemiologists like Rothman and Greenland to propose multi-causality models such as the causal pie. So we have here the illustration, the one causal mechanism and the single component cause. Each constellation of component causes, representation in figure 1, is minimally sufficient to produce the disease. That is, there is no redundant component cause. Each one is a necessary part of that specific causal mechanism. A specific component cause may play a role in one or two or all three of the causal mechanism pictured. For example, excessive gastric secretion could be the common factor A in all three causal mechanisms, but the Helicobacter pylorus is present as G in the causal mechanism 2. A given disease can be caused by more than one causal mechanism, and every causal mechanism involves the joint action of a number of component causes. The purpose of this brief glimpse into the philosophy of causation has been to lead us to the idea that disease causation is not a simple case of discovering one or more contributing factors, that other consideration like motivation for identifying the cause may be involved. There may also be a role for values. Thank you for your attention.
We continue with interviewing the patient with regards to thirst, appetite, and taste. Many people also express that they have a large appetite. This again is something that you have to be cautious about when drawing conclusions. A patient saying they have a large appetite is not always an indication of stomach fire. Many people, especially women, say their appetite is large because they think that they eat too much, but in reality, their appetite is normal. The problem is that they think that they should be thinner than they are. Some people think that they have a large appetite because they are constantly nibbling at food and eating all day long. The question is whether they are constantly eating because they are actually physically hungry, as in stomach fire, or whether they eat because they are bored, mentally restless, or to drown their feelings. These are more heart imbalance patterns than they are stomach fire patterns. Stomach fire will typically manifest with an insatiable appetite, and the person will quickly feel hungry again soon after eating. This is typically seen in teenage boys who immediately after having eaten a large meal will go into the kitchen to get a bowl of cornflakes or a sandwich. This is because their Mingmen has flared up, creating heat in the stomach. Stomach fire quickly burns up the food that has been consumed. The yang heat also creates a need for something solid and yin to create a balance in the stomach, especially something that is cold in its dynamic. Heart imbalances can also affect the appetite. Heart qi deficiency and heart qi stagnation can lead to a person either comfort eating or losing their appetite entirely, such as when people are heartbroken or depressed. Heat patterns can manifest with an attraction to cold foods. This will be both food that is cold in temperature and food that is energetically cold. This is because the body needs to cool down when there is heat. Consuming foods that are energetically hot will often have a negative effect on their symptoms. Conversely, people with cold patterns will either prefer to eat warm meals or they will feel that it is unpleasant to eat food that is energetically cold or has a cold temperature. Individuals with internal heat and a stagnation of qi or blood will often be attracted to spicy food, which is often energetically hot. This is despite the fact that they should theoretically prefer cold food. This is because the hot and spicy food will help to alleviate and disperse the stagnation. Although the hot, spicy substances will ameliorate their symptoms in the short term, they will often have a negative effect in the long run, creating further heat. Food stagnation can manifest with an aversion to eating. This is because there is a physical accumulation in the digestive system that blocks the qi. Food stagnation can also generate heat in the stomach. This can mean that the person soon feels hungry again, even though the stomach is still full. Food stagnation can also cause the stomach qi to become rebellious and manifest with acid reflux or burping, which can also be seen when there is stomach fire. This is because heat has an ascendant energy, thereby sending stomach qi upwards. Stomach fire can also manifest with a stinging or burning sensation in the stomach. Nausea can encompass anything from a lack of appetite to a feeling of wanting to vomit. Nausea is again a sign that the qi ji in the middle jiao is impaired. The reasons can be varied, and differentiation of the relevant patterns will often be based on when the nausea is worst. Nausea immediately after eating is mainly a manifestation of spleen qi deficiency and food stagnation. The nausea arises due to the spleen not being able to transform the food that has been consumed, which then accumulates in the stomach and blocks the stomach's qi ji. If the nausea manifests in the premenstrual phase or arises when the person is stressed or emotionally affected, the nausea will be due to liver qi stagnation, where the stagnated liver qi invades the stomach and spleen, disturbing the movement of their qi. Nausea is also seen in pregnancy and is caused by a disturbance of the Chong Mai. This is due to the physiological changes that the fetus initiates in the uterus. Chong Mai connects the uterus and the stomach. This means that disturbances of qi in the Chong Mai can disturb the stomach's qi ji. This is only one of the causes of vomiting during pregnancy. Other causes of morning sickness can be stomach and spleen qi deficiency, stomach qi deficiency, liver qi stagnation, liver fire, and stomach fire. If there is stomach and spleen qi deficiency, the nausea will be exacerbated when the woman is tired or if she has not eaten. Often she can control the nausea by constantly nibbling at food. If she not only has nausea but also has vomiting, the vomiting will not be explosive but more retching. If there is liver fire or stomach fire, the vomiting will be explosive and the vomit will be very sour in taste. Consuming ginger, which is often recommended to relieve nausea, will often worsen the condition if there is fire. This is because it will add to the heat in the stomach. Ginger will, on the other hand, have a beneficial effect if there is stomach and spleen qi deficiency. Most of these patterns can also be seen when there is vomiting that is not related to a pregnancy. Acute vomiting will come from an invasion of exogenous pathogenic factor or food stagnation. The exogenous pathogenic factor can be heat, summer dampness, summer heat, or cold. If there is invasion of cold in the stomach, the vomit will be watery and contain undigested food. This is because the cold has blocked or extinguished spleen yang, which is a digestive fire. The person will often have a cold sensation in the stomach, and the skin in the epigastric region can feel cold on palpation. Heat will also cause the vomit to be sour or bitter in taste, and the vomit will be odorous. This will not be the case in a cold condition. Summer heat and summer dampness will result in the vomit being yellow and watery. Observation of the tongue's coating and color is important when differentiating between the above patterns. Heat patterns will manifest with the tongue having a yellow coating, whereas the cold patterns will manifest with a white coating. Damp phlegm in the stomach will result in thin, slimy vomit. Vomit that contains blood can be seen when there is stomach fire or blood stagnation in the stomach. Blood stagnation can block the vessels so much that they eventually rupture. Fire can agitate blood so that it bursts the vessel's walls. Thank you for your attention.
Let's continue with the overview in our continuing discussion on diagnosis according to pathogenic Qi. There are 6 exogenous forms of pathogenic Qi. 5 of these forms of pathogenic Qi can also be internally generated. Summer heat is the only form of pathogenic Qi that is exclusively exogenous, where exogenous pathogenic Qi invade the body when it comes into contact with climatic influences, bacteria, viruses, allergens, and so on. Internally generated pathogenic Qi arises when there are internal imbalances in the body, especially thankful organ imbalances. It is important to remember that pathogenic Qi is defined by its origin, but also how it manifests. This means that when an internal imbalance manifests with a person having a red face, being excessively thirsty, being mentally restless, and having a rapid pulse and a red tongue, this imbalance will be defined as heat. The heat here, though, has been internally generated. That is, it is heat that has arisen due to internal conditions and not because the person has been in contact with exogenous pathogenic Qi. As can be seen in this example, internally generated pathogenic Qi is in many ways similar to exogenous pathogenic Qi. The important difference is that internally generated pathogenic Qi is an etiological factor in itself. Aside from the difference in their etiology, the symptoms and signs of internally generated pathogenic Qi and exogenous pathogenic Qi are different in quality, intensity, and duration. Exogenous pathogenic Qi tends to be acute and the symptoms more pronounced. The symptoms and signs of internally generated pathogenic Qi will usually be chronic and less intense. Exogenous pathogenic Qi will often manifest with symptoms and signs relating to the exterior aspect of the body, that is the Wei Qi, skin, muscles, joints, and channels. There will probably be an aversion to cold and a slight febrile sensation. Internally generated pathogenic Qi can affect specific organs or vital substances, or it can be systemic. There are, however, also situations where exogenous pathogenic Qi can manifest in the interior of the body. This will be because exogenous pathogenic Qi has penetrated deeper into the body, or there has been a direct invasion of exogenous pathogenic Qi into the interior. As mentioned, only 5 of the 6 forms of exogenous pathogenic Qi are generated in the interior. Furthermore, in addition to internal heat, cold, wind, dampness, and dryness, there are other forms of internally generated pathogenic Qi that do not exist as exogenous pathogenic Qi. These are phlegm, blood stagnation, and food stagnation, which are also classified as forms of pathogenic qi. Like the other forms of internally generated forms of pathogenic qi, phlegm, blood stagnation, and food stagnation are not defined as etiological factors. This is because they themselves have resulted from one or more of the internal, external, or miscellaneous etiological factors. So, diagnosis according to Qi, see Qi in relation to diagnosis according to the 8th principle. Pathogenic Qi imbalances are generally excess imbalances. This is because when there is pathogenic Qi, there is something extra present in the body. However, this does not exclude the possibility that there can be a combined deficiency and excess condition. This is seen, for example, when there is an invasion of wind cold that has arisen because there is Wei Qi deficiency, or phlegm dampness is generated because there is spleen Qi deficiency. Pathogenic Qi imbalances can be both exterior and interior. When there is an invasion of exogenous pathogenic Qi, it will be an exterior imbalance. But if pathogenic Qi is internally generated, it will be defined as being in an interior imbalance. Thank you for your attention.
Let's discuss diagnosis according to 12 regular channels, the treatment of channel problems. The treatment of pain conditions in the channel is mainly based on the use of local points along the course of the channel, the use of points in the local area, distal points of the opposite end of the channel on the wrist or on the ankle. If there is a long distance between the distal point and local points, the treatment can be supplemented by using a powerful supporting point somewhere on the channel in between them. This is called a chain and lock treatment. For example, if there is pain in the shoulder joint corresponding to the large intestine channel, Li4 can be used as a distal point and Li15 as a local point, supplemented with the adjacent points, Li14, Li16, Sanjiao 14, as well as Li10 as a supporting point. Qi points are always important in the treatment of pain conditions and blockages of Qi and blood along the path of the channel. If there is a stagnation in the joint along the course of the channel, a cross-channel method can be utilized. This is a very effective method that was developed by Dr. Xu Yuan. In cross-channel theory, acupuncture points are selected on the opposite side and in the opposite limb according to where the pain is. These acupuncture points must be located either in a similar area. For example, if the pain is in the lateral side of the right ankle, you will select an equivalent point on the lateral side of the left wrist, or the cross-channel point should be located on the equivalent spot on the same great channel. For example, stomach 36 on the left side to treat the area corresponding to Li10 on the right side, because they are both Yangming channel points and are located in a similar position along the channel. In addition to acupuncture points on the channel and local points, other points that are relevant to the diagnosis can be used. If there is heat, for example, acupuncture points that drain heat can be used. If there is a Qi deficiency condition in the channel, relevant Qi tonifying points can be used. This means that Li10, for example, would be the relevant point to choose if there is a Yangming channel shoulder pain that is due to a deficient condition, whereas Li11 would be chosen if there is a sign of heat in the joint. Lu connecting points can also be used to regulate Qi in the channels. These points can allow Qi to flow to or from the partner channel. Lu connecting points can also be used to regulate Qi and blood in the small superficial Lu vessel. This is especially relevant when there are joint problems along the course of the channel, because the stagnation is often located in the small superficial lumen vessels. For the lung channel imbalances, the signs and symptoms, there is tenderness, weakness, or pain along the course of the lung channel. There is skin changes along the course of the lung channel. There's dyspnea, sore throat, black nose, chest oppression, tenderness or pain under the clavicle, shortness of breath, pimples around the nose, upper back, and chest. For the acupuncture treatment, local and distal Qi points on the lung channel possibly combined with Li6. For the large intestine channel imbalances, for the signs and symptoms, there is pain, weakness, or tenderness along the course of the large intestine channel. There is a skin and tissue changes along the course of the large intestine channel. There is sore, red and swollen throat, parodontosis, tooth pain, bleeding gums, red and swollen gums. There is shoulder pain, frozen shoulder, elbow pain, wrist pain, facial paralysis, nosebleeds, runny or black nose, no sense of smell. Red and swollen eyes, borborygmi, abdominal pain, ulcers, spots, acne around the mouth, on the cheekbone, upper back, and chest. For the acupuncture treatment, local distal and Qi points on the large intestine channel, possibly combined with lung 7. Thank you for your attention.
We continue with treatment principles. This time, how to tonify the upright Qi. Tonifying the upright Qi includes any method that strengthens the body condition and increases resistance to disease. This may be achieved with acupuncture, herbal treatment, exercise, diet, qigong, meditation, or often simply rest. More specifically, from the acupuncture point of view, it implies tonification of Qi, blood, yin-yang essence, and original Qi by the use of the reinforcing method of needling or moxibustion. The strategy of tonifying upright Qi is applicable when this is weak, or more specifically in purely empty patterns, that is, when the upright Qi is deficient and there are no pathogenic factors. This approach can also be used in mixed deficiency excess patterns, but only if the pattern is predominantly deficient. In such a case, tonifying upright Qi strengthens Qi so that it can eliminate any pathogenic factor that there might be. Hence the saying, support upright Qi to eliminate pathogenic factors. It must be stressed, however, that this approach is applicable only if a mixed deficient excess pattern is predominantly deficient. If, on the contrary, there is a strong pathogenic factor, tonifying upright Qi may not only fail to eliminate it, but actually, in certain cases, even reinforce it and make the condition worse. This is more likely to happen when herbal medicine rather than acupuncture is used. The approach of tonifying upright Qi is applicable only in interior conditions, as exterior conditions are by definition of the excess type, being characterized by the presence of an exterior pathogenic factor. Only in very few cases of exterior conditions is it necessary to combine expelling pathogenic factor with tonifying upright Qi. Examples of purely deficient patterns when the approach of tonifying upright Qi is applicable are spleen Qi deficiency, manifesting with lack of appetite, tiredness, loose stools, empty pulse, or blood deficiency, manifesting with dizziness, blurred vision, poor memory, scanty periods, choppy pulse, pale tongue. An example of a mixed deficiency excess pattern, but predominantly deficient, might be that of stomach and or spleen deficiency allowing themselves to be invaded by liver Qi, manifesting with tiredness, no appetite, loose stools, and empty pulse, slight dull epigastric pain, and slight nausea. The last two symptoms are due to stagnant liver Qi invading the stomach. In this case, however, it is not that liver Qi invades the stomach, but rather that stomach Qi is weak and allows itself to be invaded by liver Qi. This is borne out by the prevalence of deficiency symptoms and signs. In this case, the correct course of action is to tonify the stomach, so that when this is strengthened, liver Qi will not be able to invade it. In mixed full empty conditions, in which the emptiness predominates and therefore tonification of the upright qi is called for, the pulse is an important factor in the determination of the correct treatment principle. In fact, the strength of the pulse is an important factor in deciding the relative importance of the deficiency or the excess. For example, in the example given of deficient stomach and spleen being invaded by stagnant liver qi, an empty or weak pulse indicates that the deficiency predominates. If the pulse were wiry and full, it would indicate that the excess, that is, liver qi stagnation, predominates. So the strategy of tonifying upright qi is applicable when this is weak, or more specifically in purely empty patterns, that is, when the upright qi is deficient and there are no pathogenic factors. Thank you very much for your attention.
Let's discuss the lung yin deficiency as we continue with diagnosis according to Zheng organ patterns. Unlike most of the yin deficiency patterns of imbalance, lung yin deficiency can be both a chronic and a more acute and temporary condition. This is because the lung is a delicate Zheng organ, and its yin aspect can easily be injured by dryness and heat. For example, when there is a qi or excess heat condition in the lung, such as an invasion of exogenous pathogenic heat. Lung yin can be injured by exogenous pathogenic qi, for example, dryness and heat. Exogenous dryness can invade the lung when a person lives or works in a building with a dry interior climate, such as buildings made of concrete. Lung yin will also be injured by a condition of excess heat in the lung. Tobacco smoke is both hot and dry. This means that smoking can be an etiological factor in chronic lung yin deficiency patterns. Prolonged use of the voice can strain lung yin, which can be a problem for teachers and singers. Lung yin will eventually be adversely affected by the same emotions that are involved in the generation of lung qi deficiency, that is, sorrow and melancholy. Old age will weaken kidney yin and can therefore be a factor. Symptoms and signs: there will be dry, ticklish cough that is worse at night or on exertion. There is a sticky or rubbery sputum in the lung that is difficult to expectorate. There can even be blood in the sputum. And there is also insomnia. It's dry mouth, nose, and throat, a weak voice or a hoarse voice, a dry skin, fatigue, a thin body with a thin or sunken chest, thin, dry tongue with a lack of coating in the front third, superficial and fine pulse, especially in the right Sun position. If there is lung yin deficiency, heat, there may be also malar flush, hot sensations in the palms of the hands, soles of the feet, and chests, night sweats, light fever, or sensations of heat in the night, in the evening and at night, red, thin, and dry tongue, rapid, fine, and possibly superficial pulse. The key symptoms here are dry, ticklish cough, hoarse voice, and dry throat. For the treatment principle, we nourish lung yin, possibly control deficient heat. For the acupuncture points, you can choose from lung 7, lung 9, UB13, UB43, spleen 6, kidney 3, and red 4. If there is deficient heat, we can add lung 10. We use a tonifying needling technique except on lung 10, which should be drained. For the additional explanation on the choice of points, we use lung 9, UB13, and UB43 to nourish lung yin. Spleen 6 and ren 4 nourish yin in general. Kidney 6 combined with lung 7 opens the ren mai and the yin shao mai and thereby nourishes spleen, regulates lung yin, and opens communication between the kidneys and the lungs. Lung 10 drains deficient heat from the lungs. As a relevant advice, a person who is Lung yin deficient should not smoke and they should avoid others' smoke. Living and working in concrete buildings or other buildings or places where there is a dry climate will injure their lung yin. Like a person who is lung qi deficient, person who is lung yin deficient must be careful not to overuse their voice. In general, they should avoid straining their body and make sure that they get enough rest and sleep. Strong and spicy foods promote sweating and expel qi. The excessive consumption of spicy food should therefore be avoided. This is especially important if there is deficient heat, as many spices are also hot. Milk nourishes lung yin, but caution should be exercised as it also can create phlegm in the lung. Lung yin deficiency can be caused by the following imbalance: lung dryness, lung qi deficiency, kidney yin deficiency, stomach yin deficiency, lung heat, phlegm heat in the lung. In turn, it can result to kidney yin deficiency. So to summarize, lung yin deficiency has its etiology in hereditary weakness, poor posture which constricts the breath, exterior attack of wind cold or wind heat resulting in impaired lung descending function, prolonged grief and sadness weakening the lung qi, external or internally generated dryness, biological factors leading to kidney and or stomach yin deficiency. Possible presenting condition: pulmonary tuberculosis. Its signs and symptoms are cough with which is dry or with scanty sticky sputum, weak or hoarse voice, dry mouth and throat, a tickly throat, tiredness, dislike of speaking, thin body or thin chest, night sweating, emaciation, afternoon tidal fever, 5-pound heat. The pulse will be floating, empty, rapid, and fine. The tongue is normal color or red and pale. For the treatment principle, moisten the lungs, suppress cough, enrich yin. For the acupuncture treatment, we can use lung 9 to supplement lung yin, spleen 6 to supplement yin, do 12 to relieve cough and dyspnea, kidney 6 supplements yin and benefits the throat, bladder 43 supplements lung yin, Ren 17 supplements qi and lung yin, bladder 13 supplements lung qi and yin, Ren 4 supplements kidney yin, Ren 12 supplements stomach yin, and lung 5 clears lung yin. We needle with supplementation, and for kidney lung yin deficiency, you can add bladder 23 and spleen 6. Thank you for your attention.
Let's discuss the diagnosis according to 8 principles. Excess cold. The difference in when the symptoms and signs of deficient cold and excess cold manifest, as well as the treatment itself, is not as pronounced as with heat. The difference between deficient and excess cold is seen more in the severity of symptoms and signs, and the symptoms and signs intensity, and whether the symptoms are acute or chronic. There is often an overlap between deficient and excess conditions, and one will frequently result in the person being more vulnerable to the other. Both excess and deficient cold will result in this yang qi not being able to fulfill its function. This will be because yang is either blocked as it is in excess cold condition, or too weak as it is in deficient cold condition. This will compromise the body's ability to heat, transform, transport, protect, and hold in fluids inside the body. Excess cold can arise when the body is invaded by exogenous cold. Cold can be located in the exterior, that is wind cold, or there may be a direct invasion in the interior when cold invades a food organ, the stomach, the intestine, the urinary bladder, or the uterus. There may also be a direct invasion of pathogenic cold in the channel and in the Tai Yin and Xiao Yin stages of the 6 stages. Here, next is the exterior excess cold. When there is excess cold, it is necessary to differentiate between interior and exterior cold. In exterior cold, exogenous pathogenic cold will have invaded the body via the skin and block Wei Qi. This is reflected in the signs and symptoms. There will be shivering and aversion to cold because Wei Qi is black and cannot warm the skin and protect the body against the climatic cold. This is in fact a key symptom when differentiating between the interior deficient cold and interior excess cold. In both cases, the person is cold and has difficulty keeping warm. The difference though is that when the warming Wei Qi is blocked, the person cannot get warm, even though they wrap themselves up in blanket and put an extra clothing. There is actually enough heat in the body, but is prevented from circulating through the muscles and under the skin. When there is interior deficient cold, there is an actual deficit of heat in the body. This means that if the person puts on enough clothes or blankets, they can retain the heat they do have and will feel warm. The blockage of Wei Qi will result in general soreness or aches in the skin, muscles, and joints. When wind cold invades the exterior, it is the Taiyang channel that are the first aspect to be invaded. There will be an acute headache and tension or stiffness in the shoulder and neck. This is because the circulation of Qi in the urinary bladder and small intestine channel is blocked. There will also be tenderness and soreness in the muscles and joints in general due to the blockage of Wei Qi. The blockage of Wei Qi and the contracting nature of cold will disrupt the pores in the skin so that the pores do not open. The person will therefore not be able to sweat. An invasion of wind cold will tend to disrupt and block the lung in its spreading of Jing. This can manifest as acute edema in the face and hands. The black fluids will ascend to the eyes and nose along with the rebellious lung Qi and cause watering eyes, puffy eyes, or runny nose. The fluids can also collect in the lungs and result in a cough with loose, watery sputum. The lung Qi will be rebellious because the cold has blocked the lungs, descending and spreading of Qi. When lung Qi is rebellious, there may be coughing, sneezing, or dyspnea. When there is excess cold in the exterior, the pulse will reflect this imbalance by being superficial and tight. The tongue will often not have had time to change. If the tongue has changed, it will have a thin, white, and moist coating on the front. Next is the interior excess cold. It is a condition where the exogenous pathogenic Qi has invaded the interior of the body, whose organs are in direct contact with the environment outside of the body via the body's orifices. This makes it possible for climatic pathogenic Qi to invade these organs directly. Furthermore, pathogenic cold can enter the body through the yin channels in the legs and thereby invade the organs of the lower jiao. Cold has a crucial impact on organs physiology and it has an astringent nature. Cold's constricting dynamic results in stagnation, blockage, and disruption of Qi, blood, and Jing. One of the dominant symptoms indicating the presence of cold is pain, where exterior cold will manifest with pain such as headaches and muscle aches. Interior cold will manifest with cramping or biting pain. Example of this could be menstrual pain, pain in the intestine, or abdominal pain. Because the cold is located in the interior, the aversion to cold will be different when there is an exterior condition. There is not the same blockage of Wei Qi. The person will therefore not have the same aversion or fear of cold. The cold will be more localized and internal. They will probably feel chilly and will seek heat, especially in the area of the body where cold is located, but they will not freeze in the same way as when it has been cold. Their arms and legs can feel cold. Cold extremities are also seen when there is liberty stagnation, but then only the hands and feet will be cold. When there is excess cold, the whole arm and leg feels cold. The fingers and toes may become blue due to blockaging, blocking the movement of blood. Thank you for your attention.
Let's discuss stagnant liver qi turning into heat as a pattern of depression. Clinical manifestations: depression, moodiness, worry, frustration, feeling uptight and tense, anxiety, agitation, short temper, dry mouth, bitter taste, constipation, headache, red face and eyes, hypochondrial pain and distension, tension and ache of the muscles of the neck and top of the shoulders, abdominal distension, irregular bowel movement, irregular periods, premenstrual tension. Tongue has a red body color with redder sides or normal body color with red sides. Pulse wiry, rapid. In liver qi stagnation, clinical manifestations are centered primarily in the hypochondrium and abdomen, while in stagnant liver qi turning into heat, there are also manifestations in the head, such as headache, dry mouth, red eyes and face, and bitter taste. Liver qi stagnation impairs the coming and going of the ethereal soul, leading to depression in the same way as previously described under the pattern of liver qi stagnation. The heat deriving from the long-term qi stagnation, on the other hand, agitates the mind and leads to anxiety. Stagnant liver qi turning into heat tends to be more common in people over 35. The etiology of this pattern is usually repressed anger combined with overwork and excessive consumption of alcohol. Treatment principle: soothe the liver, move qi, eliminate stagnation, clear liver heat. Points: pericardium 6, liver 3, GB34, TB3, GB13, bladder 47, DO20, liver 2, gallbladder 43. Reducing or even method on all points except on DO20, which should be reinforced. P6, liver 3, GB34, TB3, GB13, bladder 47, and DO20 have all been explained under the pattern of liver qi stagnation. As the heat here derives from qi stagnation, it must be cleared primarily by moving qi and eliminating stagnation. Liver 2 clears liver heat. GB43 clears liver heat and treats headaches. It clears heat from the head region. It is added to the point combination because the heat in the liver, as opposed to purely liver qi stagnation, causes some symptoms to appear in the head: headache, dry mouth, bitter taste, red face and eyes. Tai Yang calms the mind. Thank you very much for your attention.